Okay, let's dive into this. Welcome to The Explainer, where we're going to unpack the absolutely fascinating, high-stakes, and literally life-saving mechanics of medical toxicology. We are going to open up the Toxicologist Toolkit today and demystify the specific antidotes that stand between a patient and a critical poisoning event. It's just an incredible journey into how science neutralizes some of the deadliest toxins out there.
To really grasp why this toolkit matters, we have to look at the sheer scale of the challenge. In just a 12-month period ending in April 2021, over 100,000 people in the United States died of poisoning and drug overdose. That is a staggering number. It represents a nearly 30% jump from the prior year, and the vast majority of these cases were totally unintentional. These are the real-world stakes that make mastering toxicological resuscitation absolutely vital for us to understand.
You see, when someone is in critical danger from a poison, standard medical protocols just aren't always enough. The American Heart Association clearly states that managing these patients often differs from standard resuscitation. If standard life support is kind of like restarting a stalled engine, toxicology requires finding the exact biochemical key to unlock a cellular lock that a specific poison has completely jammed.
So, to make sense of this massive list of medical keys, we've organized our explainer into 5 logical toolboxes. Number 1 is everyday painkillers. Number 2 is cardiovascular resuscitation. 3 is environmental and chemical threats. 4 is biological toxins. And 5 is the ultimate toolkit. Let's get right into it.
Section 1. Everyday painkillers. Reversing the familiar.
You know, it's often the most familiar household medications that become deadly in excess. Take the classic scenario of a 16-year-old who intentionally ingests a bottle of acetaminophen, which most of us know as Tylenol. In an overdose, the drug produces a highly toxic byproduct called NAPQ. That depletes the liver's stores of glutathione, leading straight to acute liver failure. And this brilliantly illustrates where the antidote N-acetylcysteine, or NAC, comes in. NAC essentially acts as a substitute for that depleted glutathione. It chemically binds to the toxic NAPQ and renders it totally harmless, saving the liver. Next up, salicylates. You'll find these in aspirin, oil of wintergreen, and even Pepto-Bismol. Now, what's really interesting here is how salicylic toxicity causes this massive, multi-system havoc. It simultaneously triggers respiratory alkalosis and severe metabolic acidosis. To fix this chaotic acid-base disturbance, toxicologists deploy sodium bicarbonate. It's a highly effective antidote that works by alkalinizing the urine. It basically traps these toxic weak acids in the kidneys so they can be flushed out of the body safely.
Of course, we absolutely cannot discuss everyday killers without highlighting the opioid crisis. Opioid overdose remains the absolute leading cause of cardiac arrest due to poisoning in North America. The antidote here is a direct lock-and-key reversal agent, opioid antagonists, specifically naloxone. By physically knocking the opioid off the brain's receptors, naloxone reverses the respiratory arrest before it can cascade into a fatal cardiac arrest.
Section 2. Cardiovascular resuscitation. Unjamming the heart.
Now, when we're dealing with heart medications that cause refractory shock, standard life support usually fails. We're talking about a dangerous drop in blood pressure that completely ignores standard basic vasopressors. We need highly specific keys. For severe beta blocker and calcium channel blocker overdoses, the AHA actually recommends high-dose insulin. I know, it sounds totally counterintuitive, but it forces the heart muscle to take up the energy it desperately needs. Glucagon can also be used for beta blockers. For toxicity from the heart drug digoxin, we use digoxin-specific antibody fragments, or FAB. These are literal antibodies that hunt down and bind the toxin in the blood. And we use calcium and atropine to help jumpstart a severely slowed poisoned heart. Plus, we'll often rely on foundational supports like dextrose or thiamine hydrochloride just to correct underlying metabolic crashes during these chaotic events.
Section 3. Environmental and chemical threats. Countering the invisible.
Stepping into industrial hazards, heavy metals require a very special class of antidotes known as chelators. You've got dimercaprol, also known as BAL, succimer, and edetate calcium disodium. These are all designed to grab hold of toxic metals. For acute iron poisoning, we use deferoxamine, and for things like radioactive isotopes or thallium, we deploy Prussian blue. These chelators act exactly like microscopic molecular claws. They chemically bind to the toxic metals floating in the blood, neutralizing them so the body can excrete them safely.
The chemical reversal list goes on, and each one targets a hyper-specific biochemical pathway. For toxic alcohols like antifreeze, we use fomepizole or sometimes just pure ethanol to stop the body from metabolizing the poison.
Methylene blue reverses chemicals that damage the oxygen-carrying capacity of our blood. We use vitamin K1 and protamine to reverse dangerous blood thinners, dentroline sodium for malignant hyperthermia, and octreotide for certain hypoglycemic drug overdoses. L-carnitine helps out with anticonvulsant toxicity. Leucovorin, also known as folinic acid, and folic acid are used to rescue cells from methotrexate. Pyridoxine is the exact fix for seizures caused by the tuberculosis drug isiniazide. And finally, flumazenil can reverse benzodiazepines, though it comes with some pretty strict warnings because of seizure risks.
Now, I want you to consider this terrifying, real-world scenario from the medical texts. A team of sewer line workers opens a pipe in a confined space. Suddenly, the closest worker immediately passes out. A colleague rushes in to save him and instantly collapses as well. This is the classic hallmark of hydrogen sulfide, a knockout gas that, much like cyanide, acts as a cellular asphyxiant. It poisons the cell's cytochrome oxidase. It's literally stopping the body from using oxygen, even if the lungs are completely full of it.
For rapid asphyxiants like these, hesitation is lethal. If cyanide poisoning is suspected, the AHA says do not wait for lab tests. Treat immediately. The preferred K is hydroxycobalamin, which grabs the cyanide and safely turns it into vitamin B12. Pretty amazing, right? We can also use sodium and amyl nitrites along with sodium thiosulfate to aggressively pull the toxin away from the cells to restore cellular ATP in the brain and heart. And for severe carbon monoxide or hydrogen sulfide exposures, hyperbaric oxygen is used to forcibly drive life-saving oxygen back into the tissues.
Section 4. Biological toxins. Neutralizing nature.
Leaving the industrial world behind for a minute, we step into nature. When dealing with venomous bites, we rely on immune serums called antivenoms. Crotaline and elapid antivenoms are used for snakes and reptiles, while other specific antivenoms tackle scorpions and spiders. Because the exact species of the biting animal is rarely brought into the emergency room, for obvious reasons, toxicologists usually infer the right treatment geographically, matching the antivenom to the creatures known to live in the region where the injury happened.
And nature throws a lot more at us than just venom. We use botulinum antitoxin to neutralize deadly foodborne botulism. If a teenager experiments with a toxic plant like Jimson weed, they arrive in a state of anticholinergic delirium, the classic hot, blind, dry, and mad toxidrome. We can use physostigmine salicate to reverse that. And for farmers exposed to highly toxic organophosphorus insecticides, which cause a massive nervous system overload, we deploy pralidoxime alongside atropine to restore their nerve function.
So the crucial point here is that sometimes the very best antidote is just preventing the poison from entering the bloodstream in the first place. That's gastrointestinal decontamination. We use activated charcoal to act like a giant sponge, trapping toxins right in the gut. We also use whole bowel irrigation and other intestinal evacuants to quickly flush the system. But take note of syrup of ipecac at the bottom there. Once a staple of every single home medicine cabinet to induce vomiting, modern toxicology now officially classifies it as an antiquated antidote. It's obsolete and no longer recommended.
Finally, Section 5, the ultimate toolkit, beyond the chemical key.
We've seen dozens of specific chemical keys so far. But it brings us to a frankly terrifying question that every toxicologist faces. What do we do when the lock is jammed, the patient is crashing, and there simply is no specific chemical key that exists to fix it?
Well, per the AHA, when traditional antidotes fail, we are pushed toward radical physical support. For certain toxicities, like overdoses on the local anesthetic bupivacaine, we can infuse an intravenous lipid emulsion, or ILE. This essentially creates a lipid sink right in the blood, drawing the fat-soluble poison out of the brain and the heart. And if the heart completely stops responding, we bypass it entirely using VA ECMO. This is a machine that pumps and oxygenates the blood outside the body, keeping the patient alive just long enough until the poison can naturally clear their system.
Let's move to and see how this builds to one final absolutely crucial realization. The AHA stresses that these interventions, from the exact dosing of obscure chelators to initiating ECMO, are incredibly complex. They are rarely used by everyday clinicians. Therefore, the ultimate tool in the toxicologist's toolkit isn't a drug or a machine at all. It is a phone call.
If you are in the United States, this is the number you need: 1-800-222-1222. It instantly routes you to your regional poison center, granting 24/7 access to board-certified medical and clinical toxicologists. Canada has similar dedicated provincial centers. Having an expert guide you through the toxidrome, calculate the exact antidote dosage, and manage the resuscitation, it is statistically proven to save lives. Toxicology is an incredible, ever-evolving science of locks and keys. But it leaves us with this really provocative thought.
As new synthetic toxins and designer drugs emerge into the world every single day, will our chemical keys be able to keep up with the constantly changing locks? It's a perpetual evolutionary battle, and the research for the next great antidote is happening right now. Thank you so much for joining me in this explainer. I really hope it leaves you as fascinated by the science of survival as I am.